The national R count, which indicates the speed at which COVID infection is spreading, has started inching towards 1 and above as cases are going up now in a few states across India. As per the latest data compiled by University of Michigan, India's R count hit 1.01 on the 30th of July. As per the study, a total of 8 states have recorded R count above 1. This includes Kerala, Mizoram, Meghalaya, Sikkim, Manipur, Uttarakhand, Himachal Pradesh and Delhi. This means that the rate of infection spread is faster in these states. As many as 5 other states are hovering near the 1 mark. This consists of Nagaland, Arunachal, West Bengal, Karnataka and Telangana. Remember, the R value must be below 1 for active cases to start coming down. So this is a very important parameter that is being analyzed right now, that why is it that India is now showing a higher R factor or R value, which means that the spread of the disease is picking up. And that is not good news, because overall it would mean that the active cases can now go up if this remains the case. Now, therefore, the immediate issue, of course, is to contain the spread. Some states are particularly vulnerable in this. There are at least 8 states, a total of 8 states recording R value above 1. Ayushman joining us with more input. So Ayushman, first I would just understand what exactly this R value indicates. Why is it so worrisome?
Well, Afrida, the R value or R naught is the reproduction number, which clearly indicates that how many persons are getting infected by one person. So if the R value is below 1, it's a positive sign where a person is infecting less than one person. And if it goes beyond 1, which means every one person who is infecting, he's infecting the other person, and then this chain goes on. So the numbers get increased over the period of time. So R factor always, if it remains below 1, it's a positive sign. And this we have seen in the past few weeks in some states, like in Kerala, at one point of time it was 1.2, and that study has been carried out in which it has been seen that there has been a rising trend that has been seen in the R value, and which is a worrying factor. And of course, the limits of cases are there in the northeastern part and the western coastal part of India. But it is very important to highlight here that if the R value increases, all the calculations fall apart, because the infection then suddenly goes up and the numbers start mounting up. So it's the study which has hinted that a slight increase is definitely there and close to 1. And at places in Kerala also in northeast, we are seeing the number going more than 1. So one person is infecting one more person, and then this chain of transmission is getting established, and then the numbers increase is what this means, Afrida.
Yes, absolutely. So let me bring in Rajiv Dasgupta of the National Task Force to help us understand this pattern. Good afternoon, Mr. Dasgupta. We are at this very critical juncture where there is a lot of ambiguity on whether we are already in the threshold of the third wave. Some reports are indicating that overall there is a surge in cases. The R value has now come in terms of data to suggest that the spread of infection is increasing, and some states are particularly vulnerable. What are your inputs in this regard, sir?
Thank you. We have discussed this earlier too, and particularly in the context of some of the states such as Kerala, Tamil Nadu, Karnataka, which have been, and Maharashtra to a certain extent, which has seen increases over the last couple of weeks or so. One aspect that we need to look into is the changes at the district level, and that's about, in the context of Kerala, about half a dozen districts. So what exactly is happening in those districts? Is it about population movement? Is it about relatively less vaccination cover? Because we are now at a stage after 1.5 years when the global discourse has shifted from trying to achieve a very, very rapid control through lockdowns to what is called achieving endemic equilibrium. And therefore, the way we think and we approach this now needs a certain shift, and therefore need to move to more decentralized or district level strategies. Also, these are states which have had relatively low levels of seroprevalence means that they had actually been able to protect a larger proportion of the population in the earlier phases. So to a certain extent, this is, if I may, quote unquote, natural,
Yes.
because some people would continue to get affected in these states or maybe in those specific districts. That's one way to look at it.
Okay. Right. So at this point in time, do you see any specific concerns which can be immediately addressed in order to ensure that we contain the spread? Because with an increase in R value, we are told that the overall number of active cases will increase, and that would be a setback again. Would it undo the progress that we have made so far? And where do the vaccines come in all of this?
No, I don't think it would substantially undo the progress. All states and the country as a whole is a lot more mature now in terms of health services, in terms of understanding and control on the ground. So in none of these states, or specifically at the district level, there's no evidence yet of health services getting overwhelmed or outrun in any way. So that's on the positive side. On the worrying side, because the Delta variant is still driving the wave, infection among close contacts, among households or within, say, workspaces, these are going to be more. And those are the aspects to really focus on rather than panicking as a whole.
Yes. All right. And one last question. Would you then say that there can be no respite from COVID-appropriate behavior that has to be uncompromisingly maintained so that there is no let-up and no lowering of guard?
Vocally so. Unequivocally so. That's going to remain the mainstay because vaccination is a work in progress. Childhood, adolescent vaccination yet to begin.
Yes.
So COVID-appropriate behavior unequivocally will remain the mainstay of COVID control.
All right. Thank you, Mr. Rajiv Gupta, for joining us with your valuable inputs on this story.